Okay, let's go through patient 2 together. So we have a 42-year-old man presenting with fever, and he's passing small amounts of bloody, mucus-filled diarrhea along with quite severe rectal pain and tenesmus, so that constant feeling of needing to go even when there's nothing there. Now, straight away, this combination of symptoms should be ringing alarm bells for dysentery. Next, let's look at the risk factors, because this is really important in narrowing it down. The patient reports unprotected oral anal and anal digital sex with multiple new partners. So here, we're clearly thinking about fecal-oral transmission. And one of the key organisms transmitted this way is Shigella. Now let's confirm that using the microbiology. On MacConkey agar, the colonies are colorless, so this tells us the organism is non-lactose fermenting. That helps us rule out organisms like E. coli. Then on XLD agar, we see red colonies with no black centers. So this means there's no hydrogen sulfide production, which allows us to rule out Salmonella. So at this point, we've narrowed it down quite nicely to Shigella species. Now, taking it one step further, this patient hasn't traveled recently and is in a UK setting. So the most likely species here is Shigella sonnei, which is the most common cause in developed countries. Final answer, so overall, the diagnosis is shigellosis caused by Shigella sonnei. And in exam questions like this, the key is to always link the symptoms, the transmission route, and the lab results. That's what gets you full marks. All right, now let's quickly go through this 2-mark question. The question is asking what 2 blood tests could be used to confirm the diagnosis. Now for questions like this, you don't want to overcomplicate it. The key idea is that we're looking for evidence of infection and inflammation in the blood. So the first test is a full blood count, or FBC. This allows us to check the white blood cell count, which is usually raised during an infection. The second test is C-reactive protein, or CRP. CRP is a marker of inflammation, and it tends to increase significantly in acute infections like this. So the 2 blood tests are full blood count and C-reactive protein. And for 2-mark questions like this, just name the tests clearly, no long explanations needed.